it wasn't until I needed to figure out why I was so broken that I really found functional medicine and this whole idea of root cause of, oh my gosh, we need to be searching for deeper issues. And most of the time, those root causes are lifestyle driven. So, we don't fully understand type 1 diabetes yet, and we don't know what we can do to prevent it, but we know that lifestyle drives so much of it going forward, of how your life is going to look with type 1 diabetes, because you can have a healthy lifestyle and live a very controlled lifestyle and really understand your insulin and blood sugar issues and how everything relates and take control of that. Or you can just be hands off and eat the standard American diet and live your life and not move your body. And you're going to end up with some crazy complications that are very sad and so often preventable. So I applaud you for doing this podcast, because it's so important for people and women to realize they have way more control over their health and their life than their doctors are giving them credit for, or they even realize. So step one, know that you have a choice when it comes to your health and how your body functions.
Welcome to the Type 1 and Midlife podcast. My name is Melissa Slemp, a certified nutritional health coach and the founder and CEO of Abundant Health with Melissa, where I help women with type 1 diabetes to feel more empowered and live their best life despite their diagnosis. Each week, I will bring conversations and strategies from guest experts and my experience living with type 1 for over 40 years now. So if you're a woman ready to redefine how diabetes can look and feel for you, then the Type 1 and Midlife podcast is the show for you. Today I talk with Dr. Tabatha Barber. She is dedicated to improving women's health, and her passion is evident in our conversation today. I'm so excited to talk with her and to share our conversation with you today. And overcoming challenges like self-esteem issues and teenage motherhood, she discovered her purpose in her first published book, From White Trash to White Coat, The Birth of Catherine's Purpose. And those events inspired her to become a successful, triple board certified physician in obstetrics, gynecology, menopause, and functional medicine. And she's licensed in over half the country, and she also offers virtual consultations. As the host of the Gutsy Gynecologist Show, Dr. Barber shares wisdom supported by her functional medicine expertise. And beyond being a speaker and a mentor and a wife and mother and grandmother, she integrates functional medicine to provide women with tools for health and happiness and to aid them in their very unique and individual goals. Tune in to hear her insights on gut microbiome, hormone testing, and why hormone replacement is not something to fear, and how living a life in balance and how our lifestyle impacts our hormones and our diabetes care. Gain empowering information from Dr. Tabatha today, so listen in and be sure to share this episode. Just a reminder that nothing you hear on this Type 1 and Midlife podcast should be a substitute for professional medical advice. Please always consult your medical professional before changing your diet, insulin dosages, or healthcare plan. Well, hello, everyone. We're happy you're here. I am so excited to be talking today with Dr. Tabatha Barber. Hello, Dr. Tabatha.
Oh my gosh, thanks for having me. I'm excited for this conversation.
Yes, and we've talked a little bit before we hit record today. I'm just so excited to be in your circle and to find you and to listen to your podcast. And we'll talk more about your podcast here when we get into all of this as well. But I've learned so much from you, and I appreciate your, getting to the root cause, because even with type 1 diabetes, there's still other stuff going on with our health. So you're going to help us better understand how the gut microbiome, I said that a little funky, and how our hormones, specifically how it's different for women in type 1 in that stage of life, and just try to kind of unpack all those layers. So what is do you have a story? Is there something, because I know, and if you're okay with sharing that, your own health, and you tend to be very transparent, which is what I love about you. Which is why I do what I do as well, because women want to connect with other women who are feeling it and feeling it too, and who get it. So if you could share a little bit about it, and we're going to talk about conventional gynecology versus what you do.
Yes. Oh my goodness. So I feel like a cat sometimes because I've lived many lives and I just keep on going. Somehow I find my strength and create a new life. But essentially, I didn't have a straight path to medicine. I was a high school dropout, a teenage mom. I had a very traumatic delivery that really shaped me as a person and set me up for my purpose in life. That traumatic event really strengthened my faith and pushed me toward helping women to regain a voice and a choice when it comes to their health, because I did not have that. I had procedures done to me and things happened and nobody explained. There was no informed consent. There was no permission given,
Yeah.
And so you go about your life not really understanding why things are happening to you, or why, doctors are intervening the way they are. And I'm sure that was the same with you being a child diagnosed with diabetes, and like, here's your insulin. Good luck sticking yourself multiple times a day for the rest of your life,
Yes,
And
yes.
I remember in 8th grade, one of my first boyfriends was a type 1 diabetic,
Oh,
and
interesting.
he was very scary to me. Like, he was super fun, but we were wild children, and we drank alcohol and did all the bad stuff that we shouldn't have been doing, and because he was a type 1 diabetic, he would pass out or have episodes, and it was very scary to me,
Mm,
and so from a young age, I've often wondered, like, why is our body betraying us? Why do these things happen to us? And I was always searching for answers. And it wasn't until probably, I hit 40 and had a back injury and like it took my whole life out, that I realized that I have a lot more control with what's happening in my body than I'm giving myself credit for.
mm,
And my patients have way more control than I was telling them. I was trained to have this patriarchal view of being a doctor. Like, I know what's best for you. Let me tell you what to do with your body, and you need to listen and just do it. And typically it was like, take this medication, have this procedure, have this surgery, and no
mhm,
questions asked. And if you ask, you're being non-compliant. That's how I
mhm,
was trained. That's how conventional doctors are trained to approach patients. And
mhm,
so it wasn't until I needed to figure out why I was so broken that I really found functional medicine, and this whole idea of root cause of, oh my gosh, we need to be searching for deeper issues. And most of the time, those root causes are lifestyle driven. So,
mhm,
we don't fully understand type 1 diabetes yet. And we don't know what we can do to prevent it. But we know that lifestyle drives so much of it going forward, of how your life is going to look with type 1 diabetes,
right.
because you can have a healthy lifestyle and live a very controlled lifestyle, and really understand your insulin and blood sugar issues and how everything relates and take control of that. Or you can just be hands off and eat the standard American diet and live your
Right.
life and not move your body. and you're going to end up with some crazy complications that are very sad and so often preventable. So
Mm.
I applaud you for doing this podcast because it's so important for people and women to realize they have way more control over their health and their life than their doctors are giving them credit for, or they even realize. So step one, like, know that you have a choice when it comes to your health and how your body functions.
Wow. Yeah. Yeah. We know our body best, and we got to pay attention to those signs and those symptoms. And yeah, definitely. Right. So is there something in your residency that you wished you had known or had been taught or practiced that maybe would have changed your direction when you were first practicing?
So many things. One of the
Mm,
biggest things is that food is actually information for our
mm,
bodies. Uh, Conventional doctors are really taught that food has no impact on your health.
mm,
It's the like the saddest thing ever, especially for the gastroenterologists who all they do is work on the gut, right?
mhm,
And they believe that food doesn't impact your health when in reality, food is information. Every time you put something in your body, whether it's a food or a drink or alcohol or whatever substance, marijuana, you name it, you're giving your cells information to either be dysregulated or to be in
mm,
harmony and to function properly. And so
Good
every
point.
time you're putting something in your body, you're making a choice. You're going toward health or you're going toward disease. And we really have forgotten that truth. And it
Yeah.
breaks my heart when I see women with breast cancer. You know, they tell me their oncologist told them it doesn't matter what diet they're on. It doesn't really matter. It doesn't affect the outcome. And it just absolutely breaks my heart because unfortunately, alcohol's one of the biggest risk factors for breast cancer, and no one
Mm,
talks about that. And the standard American diet is just as bad, and it destroys your cells so that they cannot be healthy and function, and they go
mhm.
rogue and turn into cancer. So
Yeah. Yeah.
I would say that really needs to be incorporated into medical school and residency. We need to learn the huge impact that food has on our health.
Yeah, yeah, that's really good points. Yeah, it's about educating and staying close to doctors that are working more holistically, like you do. So, do you want to start with? I wanted to kind of unpack gut microbiome and hormones, and I know how it's all related, and that's one thing too. I think that's one of the frustrations that I've seen with a lot of the clients that come to me is they have doctors for every system in the body.
Mhm.
Which, the body is one system. It really all should be talking. So I think that's where, and I'm sure you see this as well, the disconnect and the medications that are not necessarily helping one another, or if there's medication even needed in certain circumstances, but it really is understanding really what's going on, the underlying foundation of what's going on with the body. So what would it be easier to start with the gut and explain how that works with us and how it may be, if it's different for women with type 1, maybe or maybe not. And I think it circles back to what control we are having with our blood sugar.
Everything starts in the gut. It really, really
I
does.
knew you were going to say that. So,
I mean,
mhm,
Hippocrates said this a gazillion years ago, and we try to like muck it all up, but that is the truth. We've known it since the beginning of time. Um, Everything begins in the gut, either health or disease. And so
mm,
you have to think about the body as a system of systems. Like you mentioned, conventional medicine likes to put everything in a silo. You go to the gastroenterologist for your IBS, you go
mhm,
to the endocrinologist for your diabetes, you go to the gynecologist for your heavy periods. And none of these doctors talk to each other about your care. And so a lot of times something is being driven by another system, but that isn't being addressed because they're viewing things in such a tunnel that they're missing the big picture. There's this fable, this old story of like three blind mice feeling parts of an elephant, and one's feeling the tail and they think it's a horse, and one's feeling the foot and thinking it's a rhinoceros, and one's feeling the nose and thinking that it's something totally different. And because they're not seeing the big picture, they're only touching one little piece of that elephant. So they have no idea that there's this massive elephant. And that is exactly how we approach medicine. And so you have to turn over all the pieces of the puzzle. You have to open your eyes to the whole elephant or so to be able to see the accurate picture. And so when someone has, say, heavy periods and IBS and mood swings or depression and anxiety, we're giving them antidepressants, we're giving them birth control pills, and we're giving them Bentyl or some other medication to slow their bowels or make their bowels go faster, when in reality, it's probably the gut microbiome and what's happening when you eat food. So I don't think most people realize that we actually have more bacterial DNA in our body than human DNA. That's how much of microbiome we have. We have a skin microbiome, a vaginal microbiome, a gut microbiome. And these trillions of bacteria, they run the show. They are how you determine how your body functions. They help you make your neurotransmitters, your feel-good hormones that go to your brain and tell your brain to be happy or be sad or be anxious. And they impact how our hormones are made, our sex hormones. They impact how we absorb fats. Here's a really sad thing that's happened to women, especially over the past 20 years, is the low fat, no fat diet that was all the craze in the 90s, that women still are afraid of fat to this day. And unfortunately, fat or cholesterol is actually the main ingredient. It's the backbone for all of our sex hormones and our adrenal hormones, our stress hormone, our anti-aging hormone, DHEA, estrogen, testosterone, and progesterone. So when we went on these low-fat, no-fat diets, we destroyed our hormone production because we didn't have enough of the main ingredient to make those hormones. And the other thing is cholesterol is the backbone of our cells, of our cell membranes. So the membranes are like what a balloon is made of. It's the core of the cell. And if you don't have enough healthy fats from cholesterol, you can't have a healthy membrane. And the membrane is where all the locks are, all the receptors that your hormones bind to turn the signal on or off. And so if you don't have a healthy cell membrane, and you're not making enough hormones, you're going to be a hot raging mess. And that all came from whether you ate enough fats and whether you absorbed those fats appropriately because your liver made enough bile and your gallbladder released the bile at the time you ate the fats. Like there's a whole cascade that has to happen, and then for someone with type 1 diabetes, your pancreas was destroyed. Your pancreas got attacked because of a viral infection, or, we don't really know per person what drives that, but we do know by and large, it's probably some viral illness you had as a child, something like that, some autoimmune component that's attacking your pancreas. And your pancreas not only makes insulin, but it makes digestive enzymes. It makes other things that your body needs to actually break down the food that you eat and then absorb the vitamins, the minerals, the fats, the amino acids, the proteins, all of that. And so we're not looking at the big picture saying, is her gut functioning okay? Is that why she has heavy periods or depression and anxiety? Is that why she has weight loss resistance? Because her gut isn't functioning. So, once I started studying functional medicine, and my eyes were opened to all this, I could no longer hand out birth control pills and do surgery for endometriosis and all of these things because I knew there was a deeper root cause that needed to be addressed.
Yeah.
Once your eyes are open, you can't go back. So that's the difference between a conventional gynecologist and a functional gynecologist is I practiced Band-Aid medicine for 15 years. I just got rid of the symptoms. I had like 10 or 15 minutes to see you, hear your complaint, and give you a prescription for that complaint. But I never fixed the problem. And unfortunately, that Band-Aid medicine compounds and adds more problems, you know? So the gastroenterologist gives you omeprazole for your heartburn. That prevents you from absorbing your fats. That makes your hormone imbalance even worse. And so we're kind of fighting against each other in these silos. And once I started practicing functional gynecology and really started to look for the root cause of the issues, not only did I fix their hormone issues and their heavy periods, but oh my gosh, their IBS went away. Their heartburn went away. Their pancreas functioned better. Their blood sugar stabilized and improved. Their insulin resistance reversed. And it's been an amazingly rewarding transition into practicing this way. And I just want to give women hope that you're fixable. Like so much of this is reversible. You do not have to live with all of these issues like the doctor says you do, especially when you transition into menopause, because that's a whole nother beast, right?
Yeah, it sure is. And you mentioned you were referring to the gut microbiome, and so so you mentioned a lot of symptoms, and and I'm going to be honest, this has been something that's always been confusing to me personally. I consider that I check all the boxes when it comes to lifestyle. So are there specific symptoms? Because you did mention some, obviously depression, resistance, insulin resistance, weight gain, period. And that's another whole conversation, because back in my reproductive years, I was a hot mess every month. And there was no connection with what was going on. I did not eat as well as I do now. My lifestyle is much more stable, more consistent now than it was 20 years ago, 25 years ago. Again, can't go back and change what I didn't do, but it sure is nice to know that. And I think it's helped me going through perimenopause and menopause now. I'm in postmenopause, knowing how all this is connected. So what would you say when it comes to testing? Would that be the first thing? Because we talk about like the GI mapping, and you probably know this testing a lot better than I do. These are just terms I'm somewhat familiar with. Would that be the first step for a woman, just to kind of gather the information, right? Gather the facts.
Yeah, I love testing. I say test, don't guess. I actually have a program called the Healthy Her Program where we turn over all the pieces of the puzzle. We try to see the whole elephant, the whole picture, because otherwise you're playing whack-a-mole medicine. Like you hit this mole and take care of this issue and another one pops up as soon as you do, because you're not actually getting to the root cause and getting some resolution. So you have to evaluate the gut. And stool testing, like GI map is my favorite stool test. It's so amazing that we can see what's living in your gut, the good, the bad, and the ugly. It shows you your beneficial bacteria, which, make up your microbiome. Those not only break down your foods, but they help you absorb vitamins and minerals. They make your vitamins. They do all the things. They protect you. There's certain bacteria that make a mucus wall that protect bad things from getting into your body. Because honestly, when you eat stuff or drink stuff, it's still technically outside of your body until it gets through the cells into the bloodstream. Then it's in your body. Because like if you think of your mouth and your anus, like it's one long tube. It's a long travel, but until things absorb through your cells into your bloodstream, it's still technically outside of you. And so our gut has 3 barriers of protection from that outside world, because we're exposed to a lot of stuff. We're exposed to pesticides on a daily basis, plastics, and all kinds of toxic chemicals. What I call Franken foods. It's like these foods that are totally made up in the factory. They don't even come from real food, or they've been modified so much that there's no nutritional value. That's why you can eat an entire bag of Doritos and still feel hungry, but you can only eat like a cup of broccoli, because you didn't get the nutrients in to trigger your brain to go, oh, I'm satisfied. I'm full. I got what I needed. So Franken foods, like, you can eat all day long and there's nutritional value. So you eat these foods and there's 3 barriers that are protecting you. There's this mucus wall made by Akkermansia and Faecalibacterium, all these good bacteria. Unfortunately, there's bad bacteria that destroy that wall, and H. pylori is one of those bacteria. It will come in and eat that mucus wall, and so you are exposed to potentially things getting into your body that shouldn't. Then there's something called gap junctions. They're the little doors on the cells, inside the cells and in between the cells. And when those get broken, we call that leaky gut. The medical term is increased intestinal permeability. Things are getting into our cells and bloodstream that shouldn't be there because the doors got broken. Then there is a 3rd barrier of protection, and it's called IgA. It's the part of our immune system that protects us from the outside world. IgA lines the gut, it lines our skin, and it lines our respiratory tract. And IgA, I like to think of it like the bouncer at the front door of a club. He's going to stand at the door and decide, are you safe to come in, or do I have to keep you out? And he'll get in a big old fight. And so when I do these stool tests, what I see often is the mucosal barrier is destroyed. There's no healthy bacteria for a mucus wall. The gap junctions are broken because the zonulin level is high, this protein that gets released. And then the IgA level is low. So there's no bouncers at the front door stopping bad things from getting in. So if you have all 3 barriers compromised, it's like a wide open field day. Anybody can come in and just wreak havoc on your body. And it causes this huge inflammatory response, because now stuff's in your bloodstream, and your other branches of your immune system, your IgG branch and your IgE and your IgM, they all have to react. So then you start developing food sensitivities. You're reacting to foods like broccoli and almonds and chicken and stuff that's normal and healthy. But because your immune system is seeing them when they never should, you start having these inflammatory responses. And then your joints hurt. You're getting headaches. You're exhausted. You're depressed. You're having eczema and acne and all of these systemic symptoms. And it's all because your gut is a mess. Your microbiome is off balance. Your barriers are compromised. And then you can add on to that bad stuff living in your gut, bad bacteria that are making lipopolysaccharides, which are toxins that get released into your bloodstream. Yeast can start to overgrow. Yeast cause a ton of brain fog, fatigue, weight loss resistance, rashes under the breast, recurrent vaginal yeast infections. And I'll mention, like, that is the number one culprit when we're dealing with blood sugar issues. So, you know, as a surgeon in my previous life, if somebody had diabetes or insulin resistance, or they just were not controlling their blood sugars, they would often get yeast infections on their incision site after surgery. And it's because they have yeast overgrowth in their gut, and then it goes on to their skin and their vagina and everywhere else. So you have to really reel in what you're eating and make sure you're feeding the right things in your gut, because if you're constantly eating highly processed carbohydrates like bread, pasta, crackers, cookies, baked goods, all of those things, you're feeding yeast and they are going to run the show. So
Mm-hmm.
good guys, the ones we want for the mucus barrier and to help you absorb your vitamins and minerals, they feed on healthy foods. They eat fiber and prebiotic starches and all the good healthy foods. And so it really does matter what we're eating, because we're feeding the little guys running the show, and that
That's a
shifts
good way to put it. Yeah.
everything.
It sure does. So testing is important to understand if there is an issue. And is this something, let's say that there's just some gastro issues that are going on for a woman. And I have a feeling you're going to say no to this, but is it okay to just find a probiotic and start on a probiotic? Because I know there's different strains, and it's not always the best case. And in some cases, it's not necessarily going to harm you, but it's definitely not going to help you, right? So is that something that we could just go to?
So I see patients all the time, and I've heard every scenario. I've heard women who went out and just bought the newest probiotic, and for some women it helped, and they were like, oh, I went from having a bowel movement twice a week to now I'm having one every day. But sometimes I get women who say it made me so much worse. It made the bloating so much worse, and feeling so uncomfortable. And it's because it matters what's living in there already. So sometimes when you have bad bacteria, the good bacteria continue to try and overgrow to fight that fight. And then if you're adding to that, it's just going to make it all worse. So you can get to the point where you have small intestinal bacterial overgrowth. Like if someone has SIBO and they take a probiotic, they're going to feel terrible. They're going to be extra bloated, because all of that, those bacteria, when they eat the foods, they have byproducts. They poop just like we do. And so their byproducts, are oftentimes gas production and other poop, essentially, that doesn't make us feel good. And so it's a crapshoot whether the probiotic's going to help or not.
Right,
And the cool thing about the testing is that we also see the rest of the function going on inside of the gut. Are you absorbing your fats? Do you need support with your bile production or your bile release? Do you need enzyme support? Is your pancreas making enough digestive enzymes to break down those foods the way it's supposed to? Is gluten driving leaky gut and angering this IgA, this bouncer at the front door? That's what I see a ton. Honestly, in the United States, we have genetically modified gluten so much that our bodies don't recognize that protein. For the majority of us, our bodies think that gluten protein is foreign, and so it's constantly reacting to it at the IgA level and driving chronic leaky gut and dysfunction. So I would say, I don't know, I might be biased because I only see a lot of sick people at the beginning, but 80+% of women who get rid of gluten have improvement right there. They have improvement with the bloating, the irregular bowels, but more so with the systemic stuff, the headaches, the brain fog, the fatigue, the joint pain, because you're stopping that leaky gut that's driving all of this, the dysfunction. So I would say everybody should do a gluten elimination diet,
I have to agree with that. Yeah. That's something that we try to practice too. We, and I'm not sensitive. I don't believe I'm sensitive to it, but, when our diet can focus on real food, it's a lot easier, right? So, if we're shopping for the fresh fruits and vegetables, and there's certain grains that I do purchase, that are not derived from wheat, and the gluten, that we can still enjoy. But yeah, it really does come back just to the basics, doesn't it? So, and like what you were saying with GI health, it's about getting the facts, getting it tested, and the first step is really healing. So a probiotic is really Band-Aid.
Right.
It's kind of a
Unless you
Band-Aid.
actually need it. If you do the test
Right.
and you have what we call an insufficiency pattern, some people have no beneficial bacteria. It's like super depleted.
Mm.
And so you do need probiotics, but I'm very specific at which ones I recommend and I choose based on the test results. And,
That makes sense. Yeah.
I do want to point out the fact that I see a ton of women have bad stool test results with no gut symptoms. So you don't
Mm.
have to have diarrhea, constipation, or bloating to have gut issues driving your other systems dysfunctions. That's really
Okay.
important. And
Okay.
if you
That's
have
good to know.
yeah,
Yeah.
if you have an autoimmune condition, you have leaky gut. You have issues because
Yeah.
leaky gut is one of the requirements to activate an autoimmune condition. You have to have the genes for the autoimmune condition. You have to have a trigger that turns on those genes and starts them going, but you have to have leaky gut to even initiate that process in the first place, or it doesn't happen. So if someone comes to me and I realize they have Hashimoto's or Graves, um, or any autoimmune condition, I want to see what their gut's doing.
Let's start with
Yeah.
yeah,
Yeah.
yeah. Start with the basic.
Yeah. So with
Okay.
my testing, I also not only do the stool test, but I do food sensitivity testing because those are triggers that are angering the immune system. But I do the Dutch Plus test. And that is a really cool test because it's a 24-hour collection of your urine and your saliva, and it's evaluating not only how much sex hormones did you produce, but what did your body do with those hormones? How did it metabolize them and break them down? Did you recycle them and use them again? Did they get backed up in your liver and your liver cannot put the garbage tag on them appropriately to be removed from your body? Or are you going down a more intermediate pathway? It's like a holding pattern. We call this 4-hydroxyestrone, where your estrogen, you didn't reuse it and you didn't send it to the liver to get a garbage tag, but you sent it down this other pathway, which can cause a quinone reaction. And this reaction damages the DNA inside the cells. And that's what can start to increase your risks of cancer, is this bad metabolism of your hormones. And so the test is really cool because you can see if you're doing that too much. And there's ways that we can intervene and shift how you're metabolizing your hormones so that they are going to the liver more often, and the liver is actually finishing the job and doing the processes it needs to remove those hormones from the body. And it also looks at your 24-hour cortisol pattern,
Really
which is your
impactful.
stress hormone. And so we get to see, are you making cortisol in an appropriate, healthy manner, or is this production dysfunctional? Have you flatlined and you have adrenal fatigue? What's going on? And it also measures DHEA. That is the other major hormone your adrenals make. And when you go into perimenopause and menopause, DHEA is critical because once your ovaries stop producing those sex hormones, estrogen, progesterone, and testosterone, to the levels that your body has benefited from for decades, your body turns to your adrenal glands as your backup ovaries. They use DHEA to make those sex hormones. And so if you go into menopause with dysfunctional adrenals or say adrenal fatigue, menopause is going to be a disaster. It's going to be so miserable because you don't have any backup ovaries. You don't have any hormones to pull from to give you a little bit of estrogen, and a little bit of testosterone. And what we've come to understand is those sex hormones are not just for your uterus, ovaries, and tubes. They're not just for reproductive purposes. We have estrogen and progesterone and testosterone receptors throughout our entire body, our brain, our bones, our cardiovascular system, our skin, like everywhere. And so when those hormones go away, every system in our body is affected, and women start to age, and women start to have an increased risk of diseases of those systems. All of a sudden, once you go into menopause, all of a sudden, you have an increased risk of heart attack. You have an increased risk of stroke. You have an increased risk of insulin resistance and diabetes. You have an increased risk of obesity. You have an increased risk of dementia. You have an increased risk of osteoporosis, all because you no longer have that protection from your sex hormones. And people argue, well, it's natural, it's normal, so just put up with it. And women get dismissed and gaslighted, like, get over it. Sorry you feel this way. Good luck. But we need to understand that just 100 years ago, the average lifespan for a woman was 48. The majority of us died around menopause in the year 1900. We did not live half of our life in the menopausal state. We have advanced so quickly as a society, yet our physiology has not caught up. Eventually, I believe menopause will happen at a later time, but right now our bodies haven't caught up. So we have to decide, oh my gosh, how am I going to live in this completely different state without the hormones that have essentially made me who I am for 40 years plus? And now I have to function as a new person. So it's kind of like a fork in the road at menopause. You have to decide, am I going to just support all my other systems and figure out how to optimize my health without my sex hormones? Or am I going to use bioidentical hormone replacement and kind of suspend myself in this 45-year-old body so that I don't go on to, age and have these diseases? And there's no right answer. That's an individual decision. But I believe every woman deserves to even have that option to make that decision and not just be told, like, good luck, suffering, that's what you have to deal with. If we would explain to women, you need to love your adrenal glands, you need to reel in your stress and get enough sleep and do all the things so that you can make a little bit of hormones from those, women would be so much better off. But we don't tell them that. We give them an antidepressant, which gives them another 10-pound weight gain, makes them no longer interested in their partner, totally destroys their libido, and they're even more depressed. So tell me how that's helping women in menopause. It's not. We are really doing women a huge disservice. We're failing them.
I'm glad you brought this up, because this is a hot topic with the women I'm helping, because I'm coaching women midlife over 40. I'm postmenopausal myself, and we can kind of circle back and talk about insulin too, about how that does, because you mentioned all those hormones once our reproductive hormones are dropping, but insulin is a hormone. And it's connected with the cortisol as well. And, all those, it's such a hot mess. It can be. I know it was for me. I was so dialed in for years with my lifestyle, my insulin rates and all of that. And then suddenly I doubled my basal rate. And again, I'm a lot of the listeners here understand what that means. It's basically a once a day shot, because I'm still on injections. And I went from 9 units in the morning to 15. And that is a huge jump. And we know how sensitive basal rates are. So I was like, what on earth is going on with this body? Nothing made sense. I gained the weight. Again, I went through the typical symptoms that we do get when estrogen was dropping. But I had to do my own digging just to find this out. I only do my own research. And I did not know of you at the time, Dr. Tabitha. So if I had, gotten that information, because this was 3-4 years ago, I think I would have been even more equipped to make the better decisions. So why do you think, and I know this is probably a wide open question, because a lot of the ladies that I meet and some who I coach, they're not getting the hormones even tested. The doctor is dismissing the fact that they want to know, and maybe we don't need to know the numbers, the levels, because our body's speaking, the time of life that we're going through. And obviously, once we've missed a period for a year, that's kind of all the indicators that that's the stage we're in. But do you think it's necessary to get the actual levels tested?
If you have gone an entire year without a period and you're essentially in menopause, I know your sex hormones are low. I don't need extensive testing. I love seeing how you're metabolizing them, because that can be really important. But I want to see what your adrenals are doing, your backup ovaries. I want to see what your DHEA level looks like. And your cortisol is so important because what was happening to you most likely is when you're no longer making sex hormones from your ovaries, you're relying on your adrenal hormones. And if the cortisol has to increase to give you your energy production and handle your stress and do all of that, cortisol tells the liver, I'm either going to fight or run, because essentially it's a stress hormone. And stress can be good in small amounts. That is, we have something called the cortisol awakening response. So we have this increase in cortisol the first 30 minutes upon awakening every day. And that is our body's natural cup of coffee. It gets us functioning. So we do need that cortisol. But it also tells the liver to do gluconeogenesis. It says, oh, she's about to like get up and do stuff. She needs more sugar in her bloodstream. So your liver will actually make glucose and put it in your bloodstream. You don't even have to eat anything or drink a glass of orange juice. So your cortisol production directly affects your blood sugar levels. And nobody takes that piece into account, especially, I guarantee, like, I didn't learn any of that in medical school when I was understanding diabetes and insulin replacement, all of that stuff. Nobody talked about the cortisol response or any of it. And it has such a huge impact. So it makes total sense to me that your insulin doubled at that time. And that is why, because all of a sudden your adrenals are the only ones in the game now, and they're having to work twice as hard. And so if you're lifestyled in and you don't have a stressful life, it's going to be a little bit smoother. But if you hate your job, or you got stressful kids, or you're in a stressful relationship, or good stressors, like you're trying to train for a marathon or doing these intense cardio HIIT training classes and Orange Theory and all the things to be healthy, that is a huge stressor on the body. Your cortisol is going to double and your insulin requirements are going to double. I see this all the time. Women are like, but I'm trying to lose weight and get healthy. So I'm like doubling all my workouts. And that is doubling your hormone requirements.
Right. It's amazing. Yes. Do the opposite.
Yes.
Yes. Because as a society, we're told to go and to burn and calories in, calories out. But it definitely changes. Well, that theory, I don't think and that's another whole topic, just based on food, the types of food and how our body responds to it. But especially at this time of life when we've got to consider what the hormones are doing. So if you wouldn't mind mentioning,
what? I don't think I answered your question. I apologize.
No, that's okay. Yeah.
Should we get testing?
Yes.
Okay. Here's the problem. We go to gynecologists as women's health experts. Unfortunately, gynecologists are surgeons. I spent 4 years in a surgical residency, learning how to do a hysterectomy 4 different ways, instead C-sections and procedures and colposcopies. Gynecologists do not study the endocrine system and the hormones the way that they should. They don't understand how all the other systems impact the hormones. Literally, what I was trained was you give birth control pills for any hormone issues. And then in menopause, you can give estrogen and synthetic progestins or an antidepressant. I did not understand hormones until I went on to study functional medicine and anti-aging medicine. I did not understand them as a gynecologist, and the majority of gynecologists do not understand them. So we're asking the wrong people for help. So if you ask a gynecologist to test your hormones, you're probably going to be told there's no way to do that. They fluctuate all the time, or we don't really know what that means, or they'll do a couple tests And if it looks like it's in the quote unquote normal range of the lab that they give you, then they tell you you're fine. And that is probably the worst case scenario, because then women get this false reassurance that they're fine when they're really not fine. Those lab ranges were created, I think, in the 1940s based on women who had either didn't have ovaries, so they had no hormone production, or they had tumors. And so it's essentially looking for tumors and disease and bad things. So you cannot use the ranges on the lab sheet. Just totally ignore them. And if your doctor's using them, they don't understand hormones. So
that's a good point that I didn't understand.
Yeah. Okay. And so we're just asking the wrong people for help. So don't be even frustrated with your gynecologist. They don't know how to help you during this midlife time. So you do have to find somebody else to help you through that.
Okay. So what about bioidentical? And just to end my story, I am on bioidentical hormones. So I went on that route. I did find a good doctor that was willing to sit with me and talk about this. And we started slow with my dosing. And all of those symptoms that I mentioned went away, including my insulin resistance. So, and it took time, as you can probably agree with. It takes time. It's not like just, I'm flipping a switch. It took probably 6 months to a year, really, for things to just kind of settle down a little bit. But at least I knew I was on the right path and that this was a good investment, that I was doing the right thing for my body. So very thankful for that. But there's a lot of confusion. I think the number one thing I get from women is, well, there's a history of breast cancer. They're afraid of cancer, the effects of birth control, hormones. They avoid it based on that fear. Yeah. But there's obviously different types of hormones too, obviously bioidentical, and how they're derived. So can you explain that?
We need to understand that hormones do not cause cancer. Hormones are wonderful and they keep us healthy. They slow down the aging process. Hormones got a bad rap from a study that came out in 2002 that, unfortunately, 18 years later, the lead investigator of that study admitted that they went into that study with bias. They wanted to prove that hormones were dangerous. And so the minute they saw any change in the numbers, they stopped the study early. They halted it as soon as they started to see any kind of change in the numbers. The numbers were not statistically significant. So the results of that study, unfortunately, are not founded. But the media went wild with this and scared everyone and scared doctors into thinking they were going to be sued and harm their patients. And so overnight, literally millions of women were taken off their hormone replacement. And mind you, we were using hormone replacement for decades prior to that, and women were healthy and thriving. And I had the good fortune of the first practice that I started when I came out of residency. I inherited from a very older gentleman who he retired at like 74. And so he had a very mature practice that he was giving me. I had women in their 60s, 70s, and 80s on hormone replacement because he was smart enough to not be afraid, because he had seen how wonderful their lives were on hormones. And so just after this study comes out, I go through residency and I'm just taught that hormones are dangerous. Use the shortest dose for the shortest duration, only in certain women, and be careful because everybody's going to get a stroke, or breast cancer. And so I acquire this practice with all these women on hormones, and I had to learn a lot quick because they were like, there's no way you're taking away my hormones. Don't you dare. They threatened me.
That's interesting.
And I learned so much from my patients. I learned that hormones do keep us young. Like when I would compare the 80-year-old who didn't take hormones with the 80-year-old who did, the woman who didn't usually had uterine prolapse to the point where her uterus was falling outside of her body. She was developing dementia. She had osteoporosis and, broken hips and hip surgery and no sex life and like all of the stuff. And then I had the hormone women who were playing pickleball and still sexually active, and their minds were sharp, and they were traveling, and they were enjoying life. And it was so obvious to me, the difference that I really kept learning about hormones, because I knew that what was out in the media and what was being taught to gynecologists had to be wrong. Like, it didn't make sense to me. And so once I found this whole world of health and wellness with functional medicine, anti-aging medicine, I realized there's thousands of studies done on hormones, but none of it gets the media attention because it's not fear-driven. It's not trying to drive, people to make fear-based decisions. And so we need to understand that hormones make us who we are. Hormones are safe and healthy. When we have trouble with hormones is when we start to add in things that don't belong in our body. When we drink too much alcohol, that means every day, glass of wine, 2 glasses of wine, cocktails every weekend, we don't metabolize our estrogen properly. It goes down that bad pathway we don't like, and that can drive our cells to become dysfunctional. So it's not the estrogen that causes the breast cancer, it's the alcohol and everything else that burdens the liver. Tylenol PM, Benadryl, other medications that we should never be on, statins, all of these things, all the garbage Franken foods. All of that is what's driving cancer. Cancer is a metabolic disease. You have elevated blood sugars that are very inflammatory to the cells. It's not the hormones. So unfortunately, that myth, it's taking a long time to get debunked. We're getting there. People are realizing the benefits, more and more people, but not in the conventional space. So
it's going to take
it's
time.
really sad. And they just have it so wrong. Like, you should follow my friend, Dr. Jen Simmons. She was a breast cancer surgeon for a long, long time. And it's her mission to really educate women on the root cause of breast cancer, because it's not your hormones, I promise you. And hormones are actually protective. There's studies going on right now that are showing that testosterone replacement decreases recurrence and metastasis. And, we're all afraid when we hear breast cancer has estrogen receptors on it or progesterone receptors. That's actually a good thing. I know that conventional medicine wants you to think that's a scary thing, but it's a good thing. It means that breast cancer cell still looks somewhat like a normal, healthy cell. Normal, healthy breast tissue cells have estrogen and progesterone receptors. Once they no longer have those receptors, then that cell is so distorted that it no longer looks like a natural breast cell. So having estrogen positive breast cancer or progesterone receptor positive cancer is actually a good thing. And that doesn't mean you need to be afraid of hormones. Okay, so we have it so wrong. It just angers me. So if people are feeling overwhelmed or super confused by all this, just take a deep breath and know that
like that. Yes, it is a lot of information, and
it is a lot of information. And I was angry when I started learning this stuff. I was angry that I didn't know this as a doctor, and how could I not know this for my patients? And then I just decided, you know what? We should all be lifelong learners. Knowledge is power. Just keep researching. Just keep listening to podcasts like this and reading the books, and not relying on the white coat for the answers, because the information is out there. It's just not in the conventional space.
Yeah,
So
sure is.
you'll
And
find it. You'll get there.
Yeah. And another thing that I try to emphasize too is how unique we all are too. I think there's a lot of comparison with women. we'll be in our group of our circle of friends with other women. And I think it's good to learn from one another, or, to maybe get some guidance as to what our first step is, but to not compare our health journey with our friends. It's so unique. Yeah.
Comparison kills. It really does. And the biggest thing that you can do for yourself is to believe that your body is capable of healing and reversing these problems. Because I get women who they've given up hope. They have been told by so many doctors that this is it. This is your lot in life. You just have to feel this way and put up with it. And you have to make an active choice in your mind that you're not okay and you're not going to just put up with it, that you're going to seek out the answers, because they are out there. You can have an amazing life. Our body was actually created to thrive until your last day. Like,
it sure was.
It was.
Yes, that's the way the Lord made us, didn't he?
Yes, exactly.
He wants us to be happy and healthy and sound, for sure. Well, you've taken us through the steps. We started with the gut microbiome, and I really appreciate all your time today. You've given us so many nuggets, and we talked about the hormones and how important all the different systems should and can work together, because that's how our body was designed to work optimally. Is there 3 takeaways, maybe some quick tips that you would give a woman who she might be listening to this thinking, yeah, I probably need to find out about that, or I probably should get this tested. Maybe I should consider talking to, and it's funny you mentioned, don't talk to your gynecologist about hormones. So they could obviously reach out to you, Dr. Tabitha, but what kind of path would you recommend that women take when it comes to finding answers to all the things that we talked about today?
So you got to do some foundational stuff. You got to make sure you're checking the box of all the basic things. Have you cleaned up your eating and your environment? If you're still eating your food in plastic, drinking out of plastic water bottles, all that stuff on a regular basis, you have a high toxic burden, and you need to address that kind of stuff. If you are still eating out of boxes and bags, all the processed Franken foods, you need to make that shift. Like, you need to go clean, do Whole30, do something to clean up your diet. Prioritize sleep. You need to be getting 8 hours. You can't act like you were when you were 20. You have to move your body every day. God actually created our bodies to move all day long. I don't do it enough because I have a desk job. And I know, like, it's constant thing. Like, I need to move more, because it moves our lymphatic system. It moves our cardiovascular system. It keeps our muscles strong, and our muscles are our main blood sugar regulators. You have to have strong muscles in menopause. And so you got to do all the foundational stuff. You need to be on some basic supplementation, because our food is depleted of basic minerals and nutrients in this life. We've depleted our soil so much. Is your water clean? Are you filtering your water? Like, check all the basic foundational stuff. And then you can say, okay, what am I doing with my adrenal glands? Because now they are in charge. Now that my ovaries are no longer running the show, what are my adrenals doing? Am I letting stress get the best of me? Am I in fight or flight mode all day? Is my brain on overdrive? Am I like holding my breath and not breathing half the time? And you got to get into parasympathetic rest, digest, and restore mode. You have to use something, like, if it's meditation apps on your phone every day, a breathing technique that you love, tapping, something to regulate your nervous system and shift you into parasympathetic mode. And I have podcast episodes that go deeper into this. If people are like, what the heck is all of this? And the cool thing about podcasts is that you can pause them, you can come back, you can listen again, you can slow it down, you can speed it up. I love listening to podcasts, because you can just absorb the information as many times as you want. I've listened to the same podcast probably 3 times on something that was like really a lot for me. And I was like, man, I need to hear that one again.
Yeah, I've done that as well. Good
Yes,
information.
exactly.
Yeah, you got to go back in and dive in.
So you
Yeah.
got to dive back in. So if you got the foundational stuff, you're loving on your adrenals, and you're still having issues, then you have to like seek out a provider, a functional practitioner, or an anti-aging integrative medicine specialist. You can go to ifm.org. They have practitioner lists, a4m.com. You can come see me. My group is licensed in over half the country, so you can see my team. You can do the Healthy Her program if you're like, man, I need to look at all the pieces of the puzzle. This is like speaking to me. You can come see us.
Yes.
And that would probably be the next step.
Yeah, I appreciate all that. And we're going to link all of your contact and your sites right here in the show notes, just so people can reach out to you. And
Awesome.
we could have just talked all day, I think.
Yeah, I could go on and on all day.
I can. Well, and I sense your passion. You are doing exactly what you should be doing, because you have such a gift. You have such a warm, giving heart. I see that just following you and being able to sit here and talk with you today. I really appreciate your time and sharing your gifts.
Thank you for all your work you're doing. It's so important that we do support other women, and lift each other up and share our stories and just help us navigate all of this.
It sure is. Yes. We all need a roadmap for sure.
Yes.
And support is so important. Okay. Well, thanks again, Dr. Tabitha Barber. And again, I will make sure everybody can reach out to you and stay in contact with you. And I know you have some free resources on your site too. And stay connected. So everybody have a beautiful, hope-filled day, and we'll see you back in here next week. Thank you for listening to the Type 1 and Midlife podcast. Head over to iTunes to subscribe, rate, and leave a review. It's very much appreciated. Thank you. And be sure to check us out at abundanthealthwithmelissa.com for our free resources. See you next week.